Wow. Okay. All right. Slow computer today. My PowerPoint's not responding, so let's always something, it seems like. Okay. So hopefully you guys can see my slides. I know that we've had troubles with that before. I don't have a whole lot today. One, I just wanted to review, because we've still gotten some questions. I know the CDC did make some updates to their operational strategy to allow spacing between students to go down to 3 feet in some situations. But just so you know that that doesn't, sorry, turn certain things off here. That doesn't change how we do our contact tracing. So a close contact is still someone who is 6 feet or less within proximity to someone with COVID. So again, even if you're allowing students to sit 3 feet or closer, a close contact is someone who is within 6 feet. So hopefully at some point we'll be able to take a look at that and maybe make some accommodations. But right now, given the big increases in cases we're seeing in younger age groups and the variant spread, we really can't make any adjustments to that. We just got some updates in antigen reporting because of the time involvement with reporting every single negative antigen test. They're going to modify it so that you need to report everybody with a positive antigen test. You need to report all of those details through the portal like you have been. And then at the end of the day, you need to just provide a total number of individuals that had a negative test. That way, our percentiles for percent positive will stay correct, but you don't have to enter in all of that information for every single negative test that you got. You can keep doing that if you would like to, and then that way they're on record. So if they do become positive later on, that is in the system. I found out though that the portal is not going to change to accommodate that mass reporting of the negative results until the 10th. So for now, we're still trying to figure out how you are to report that batch testing for the negatives. My assumption would be you would just report it at the end of the day to your county communicable disease nurse. But we're trying to figure out how that is to happen over this next week and a half until they have that portal updated. So I know last week we talked about how important it was to make sure you report both the positive and negative so that the percent positivity was correct for your county. This is a way to keep doing that, but just to make it easier so you're not spending so much time entering in all that information for each individual person. Starting Monday, if it's not already available for everybody 16 and over in your counties, I know some of our counties have already been doing this, but just so you know, everybody 16 and over, regardless of health conditions, can start getting vaccinated on Monday. I did include some links for the CDC, and also the state has some literature you can use to help with education. As much as you feel comfortable to encourage that for your students and their families, just to help with the rapid increases we're seeing in cases in those age groups. For our data review, I want to make sure that it still shows that I'm sharing the screen. So you should still be seeing this, but our data obviously is not going in the right direction. So for the state as a whole, the daily cases per million are up to 366 per million. It was 237 last week. Percent positivity is up to 13%. It was 8.4%. Central Michigan district on average is 289 per million. Last week it was 197. Percent positivity is 11%. Last week it was 7%. Some of our counties, again, we've had some outbreaks and clusters. And so for some of those counties, it doesn't take much to push them into these much higher categories and higher percentages. Same with District 10. Their average is up to 299, basically 300 cases per million. Last week it was 252, and percent positivity is 14. Last week it was 10.5. Same thing, we've had Wexford County last week, we got numerous cases reported. We've had some very large outbreaks there in some workplaces, and we've also gotten some school outbreaks reported. So things are just going in the wrong direction, and I think you're all aware of that. Mid-Michigan district, the average is 329. Last week it was 187. Percent positivity is 9.6. Last week it was 5.8. So we will share this data, but again, I think probably most of you are aware that that has been the trend. So from the report for the state of Michigan, our percent positivity is up 224%. We have the third highest number of cases and the third highest case rate in the country over the last week. Our inpatient bed occupancy is increasing. Hospitalization rates have been increasing. Deaths are now increasing. That had been holding steady. We have the 15th highest number of deaths and the 26th highest death rate over the last week in the country. So these are the curves for the state. The top one is the percent positivity. So in terms of that, we're getting back towards where we were in December. The daily cases per million, again, getting back towards December rates. And the hospitalization rate is starting to creep ever more upward. We're not quite back to where we were in December, but it is getting that direction. These are the age group breakdowns. And just showing here this highest incidence here is the 10 to 19-year-olds. So our school-age children have the highest daily cases. These next clumps here are also the younger age demographics. This one here in the middle is the 50 to 59. Then we have the 60 to 69. The red one here is the 0 to 9, and so that's kind of disappointing to see they've gone from the lowest incident now to the third from the lowest incident. So that is a disappointing thing to say. Now our lowest two are the 70 to 79 and the 80 plus ages. So again, we'd like to say that this is a promising sign that our vaccination efforts are impacting the rates of COVID, and that's why there is this shift in this trend. As to why some of these younger groups are increasing, the feeling is it's, those are the groups who are likely to be congregating and gathering together. These are the hospitalization trends, just a really rapid increase. This is the ICU census, and just of note, these are the different regions in the state. We have counties in 1, 3, 6, and 7. Our ICUs for the most part are between 75 to 85% occupied, and about 15 to 20% of those beds are occupied by COVID patients right now. So again, those are the things that we really start to worry about. These are the hospital admissions by age group compared to the surge in October, November. So the dark blue line is what they were in October, November. The lighter blue line here is what they are now. So just showing that the hospitalization rates right now for the 0 through 19, 20 to 29, 30 to 39, 40 to 49, and 50 to 59 age groups are all higher now than they were back in the last surge, and they're lower for the 60 through 89 age group. So again, we think that's optimistic signs that the vaccination efforts are working, but we don't like to see higher hospitalization rates for our young people. So these are the variant case counts as of the 28th of March. They're already quite a bit higher at this point. As you can see, more and more of Michigan is getting confirmed variant cases. Today we got our first report of one in Isabella County, so that county is now yellow. We're second only to Florida, and literally just 2 minutes before we started, I copied and pasted this from my email. They have now identified the Brazilian variant in Bay County. This is a press release, so it is public knowledge. So if you look back here, we had the South African variant. There's been 6 of those identified. We did not previously have this Brazilian variant, but now we do have it. So now we have all 3 variants in Michigan. The Brazilian variant, there is a little more concern that it may not be as well covered by our vaccines. It still is covered by the vaccines, but the Brazilian and South African variant has a little different concerns than the B.1.1.7. So when we're seeing some of these outbreaks spread really quickly and get really big really fast, those are often caused by one of the variants. So these are our outbreaks that we have had in the last week. Nursing homes now are the 3rd highest number of outbreaks. Traditionally that's always been our number 1. Our number 1 is the school system, followed by manufacturing and construction. We've had 41 new outbreaks in the school system. About 20 of them were in the high schools, and about 11 were in the middle schools. So continue to have some struggles in those settings, as you can see. I went through our 19 counties, and we've had we had 3 new outbreaks in elementary schools. We had 1 new outbreak in a junior high, and then we still have 3 ongoing in junior highs. 3 new outbreaks in high schools, 3 ongoing outbreaks in high schools. So continuing to have some struggles there. I did pull all of our outbreaks in our counties and looked at the ones that were in schools. Keeping in mind that, they may not all be completely investigated at this point. And just as a note, over 60% of them were started or spread in part due to some kind of an athletic team. It's not saying that the activity of playing the sport spread the illness, but again, being close together, spending a lot of time together with athletics is a risk. So we've had, a lot of complaints about that we're putting unnecessary attention on the risk of sports. So I just wanted to point out that it is a higher risk activity, not necessarily just the playing of sports, but the whole package of to me, it's like a second family. You're spending a lot of time together, very close together in locker rooms, buses, before and after games or meets. You know, it's just a very close activity. About 14% of the outbreaks had some other social event identified as a potential link. One had both athletics and a social event identified. So I just wanted to mention that. And again, one thing I found as a report from the Children's Hospital of Philadelphia, again, in sports, we do know that there is an increased risk of transmission, but it appears to mainly be driven by the off-field interactions in the teams, like in the locker rooms, on the bench, on the sidelines, before and after games, parties, banquets, things like that. So as much as you can, I would just encourage your athletes to really be mindful of those activities and the risks that they confer in order to be able to keep competing, you know, to not miss out on meets or games due to illness or quarantine, to not jeopardize their ability to stay in school or their classmates' abilities to stay in school. Because, you know, again, we really are seeing some major increases in cases and outbreaks. And that is, again, the number one associated link. Our testing time is still about the same, so it does not seem to be a limiting factor. I did put this in this time. This has to do with our ability to investigate cases. We are starting to get a bit overwhelmed with cases. About 33% of cases are completely investigated. So again, the investigation for a case is quite detailed, and we don't usually get the entire thing filled out because it's hard to get all those, hard to get all those things completely filled out. But usually we get about 40 to 50% of it done. And this is counting our state investigators as well, but it is starting to drop due to the overwhelming number of cases we're getting. About half of people, when they are called, do know, or the close contacts, or I'm sorry, the people that are infected do know where they probably caught it from, but only about a quarter of them were already in quarantine due to that exposure. So I will stop at this point. I'm sorry for all the computer interruptions here. Obviously, I don't have my settings quite right. And see if I can, oh, shoot. Okay. See if I can find my questions here. Okay. Okay, so this question I've gotten before and I don't know how to answer it, but as a district, we jeopardize funding if we don't offer 20 hours of in-person instruction. Has there been any talk with legislators about forgiveness if a district feels it is in their best interest to pause in-person instruction? Otherwise, we are going to continue to go with in-person instruction against our better judgment. So from a public health standpoint, that has not really been something that we know a lot about or that we have really discussed much. So I mean, we're happy to help with that, I guess, but I'm so sorry for all these problems. But again, from a public health standpoint, we're not really familiar with the educational regulations. You know, we feel that in-person education is best from a student's health and education standpoint. And even back in the winter, there really isn't that much risk of in-person transmission to much extent. But again, we aren't really familiar with school policy and educational policy. So I guess we can't really comment much on that. Is it possible that the increases we are seeing are related to lower immunity in our kids due to the proactive measures used to reduce the spread over the last year by the state? Now we are more open and people have not been around a lot of people. Could our natural immunity be lower? For example, when we started school in the fall, we often see increases in colds and other illnesses 3 to 4 weeks after we start. So it is true that most of us do not have natural immunity to COVID because we've been trying to prevent infection to COVID. And the idea there is that we don't want people to get infected because there can be serious repercussions in the person getting infected or the people they spread it to. So as people stop complying with prevention measures, which they're not supposed to do, but we have people that are stopping complying with prevention measures, they are going to catch it because they're not naturally immune. That's why we need people to get vaccinated before they stop prevention measures. Also, there are people who have had natural infection and that natural infection wears off. And so they may erroneously think they're protected and not get vaccinated. So we do, if you've not been infected or been vaccinated, you don't have natural immunity, you don't have immunity. And so again, we need to continue using our mitigation measures of masking, distancing, hand washing, avoiding gatherings, those kinds of things until we can get 70% or more of our population vaccinated. The problem is that we've had a lot of people kind of jump ahead to the end before we get to the herd immunity part. So that is correct. It's just we could prevent the illness part if people could just stick with the mitigation measures. The other reason we're seeing younger people getting ill is because the older people aren't getting ill. And so just by statistics, if one group is more protected, then your bulk of illness is going to be in another group. Are you seeing individuals who have been vaccinated contracting COVID? If so, what is the data on that? I pulled it up last week and it has been under, well, I don't want to, it's been a very few, an extremely low number of people in the state that have been vaccinated have been infected. Every time we do get a case like that, we do work to collect samples to see if it's one of the variants, collect samples of blood to see if their antibody levels may not have responded as we expected. With talking to hospital colleagues, we know that very few, if any, last I heard, most of our hospital systems haven't known really of any vaccinated people that have ended up in the hospital. Again, I don't talk to all the different hospital systems, but it does seem to be working quite well to prevent severe illness. But yeah, we've had very, very few what we call breakthrough infections. But again, with 95% effective, you still would expect some infections to occur, but it really has been a very, very small percentage, extremely small. In terms of actually providing those statistics, I don't know if the state ever would do that or if they plan to do that. But again, just from looking at the numbers, it is exceptionally small. Any other questions? You can either add them to the chat or unmute yourself and just ask them.
There were some add to the chat, Dr. Morse.
Oh, thanks. Okay. If there are repercussions for those who are supposed to be in quarantine but still choose to travel on spring break, should we do anything with this information or sit on it? So the recommendations are, if you travel either domestic or international, Individuals are encouraged to get tested on their return and encouraged to self-quarantine. There's no recommendation that you as a school or an employer require people to quarantine. So, I mean, individuals on their own are encouraged to, on their own, quarantine themselves. But if they come to school or work, unless you want to make it your own policy, there's no recommendation that you make people quarantine. Again, I would communicate with your families and students to be extra vigilant for any signs or symptoms of COVID. Have your teachers be very vigilant watching students for any signs of illness, and just make sure that if there are people with signs of any kind of illness that they stay home or go home right away. But it will be a tricky couple of weeks. Can you please explain again about the requirements to quarantine for individuals that have received the vaccine? If you are fully vaccinated, which is being 2 or more weeks out from your last dose, so your second dose in a 2-dose series or your 1 dose of a 1-dose series, if you are exposed to someone who is contagious at 2 or more weeks from being fully vaccinated, you do not need to quarantine. That applies to everybody in any situation unless you live in a group home setting. So if you have someone who happens to live in a shelter or some kind of a group home, which, you know, I don't know that many of our students would live in that kind of a situation, that rule applies. So if it's a classroom exposure, a family member exposure, whatever, that rule applies. But it's when the exposure takes place is past that, is at 2 or more weeks after fully vaccinated. And they don't develop symptoms. So if anyone develops symptoms after they've been vaccinated, they need to be treated just like anybody else. If they have symptoms of COVID, they need to isolate, get tested, because again, it is extremely rare, but they could still become infected. Any other questions? All right. Well, my hunch is probably most of you on this call will be on break next week. I will still have another call next week, but it'll be probably a little bit shorter like today was, and we'll make sure and post everything online. So if you have any questions or anything, just let me know. Have a great rest of your week.